Distinguished delegates and colleagues, it is a great honor to represent the African Research Network for Non-Communicable Diseases, ARN-ncd, and to share our vision for the Pan-African Research Institute, PARI. Our mission is clear: to strengthen African leadership in research, to address the growing burden of non-communicable diseases, and to link science, innovation, and climate resilience. The ARN-ncd was created to unite researchers and institutions across Africa who face the same urgent health challenges: hypertension, diabetes, cardiovascular diseases, all of which are being worsened by climate change. The PARI, our Continental Institute under development, will provide the infrastructure and long-term vision to anchor this effort, much like the NIH or INSERM, but focused on Africa's priorities. Our network now includes 37 centers in 22 cities across 20 African countries, working in English, French, and Portuguese. This diversity is our strength. It allows us to generate data from real-life African contexts, build local capacity, and ensure that evidence is transformed into policies and tangible impact. The vision of ARN-ncd is to promote African-led science. We aim to empower our researchers to conduct operational and translational research addressing local and regional health priorities, while ensuring that our findings influence public health decisions at national and continental levels. In 2023, the Dakar call brought together over 80 experts and 14 scientific sessions from 25 countries. It marked a turning point in uniting African researchers around shared goals: to accelerate the response to NCDs, to foster collaboration, and to ensure that Africa speaks with one voice in global health debates. We are building a generation of African research champions through mentorship, exchange programs, and regional hubs. Young scientists are trained not only to produce data, but to turn data into solutions through a culture of operational research and innovation. Our studies are community-based, our approach participatory. We connect local realities to global priorities, from prevention to health system strengthening, making Africa a living laboratory for resilience and innovation. The evidence is stark. Africa invests only 0.5% of its GDP in research and development, compared to 2.4% globally. Yet we face 37% of global NCD deaths, with less than 3% of the world's scientific publications. This imbalance is unsustainable. The World Bank data shows developed countries spend more on R&D each year than the total GDP of dozens of African nations combined. Without investment in science, we cannot achieve health sovereignty. Africa must invest in knowledge to control its destiny. Total GDP of dozens of African nations combined. Without investment in science, we cannot achieve health sovereignty. Africa must invest in knowledge to control its destiny. Research and innovation are not luxuries. They are prerequisites for sovereignty. We must close the funding and capacity gap and establish regional institutes like PARI to anchor excellence and scale impact across the continent. The Pan-African Research Institute will serve as a continental hub, connecting research, policy, and innovation. It is modeled after the NIH and INSERM, but rooted in African realities. Its goal: to catalyze financing and coordinate actions across nations. The data on life expectancy reminds us why this work matters. While the world progresses, Africa still faces gaps of up to 30 years in life expectancy. This divide is not inevitable. It reflects our collective investment in knowledge and systems. We are laying the foundation, literally and figuratively, for Africa's future research capacity. But to build PARI and sustain the ARN-ncd, we need your partnership from governments, donors, and global institutions to turn this vision into action. Today, I invite you to join us in empowering the next generation of African scientists. Together, let us transform health data into equity, innovation into sovereignty, and research into development. Thank you.